What is lupus? Lupus is systemic lupus erythematosus. Lupus, or SLE, is a system autoimmune disease in which the body's immune system mistakenly attacks normal, healthy tissue. It can affect the skin, joints, kidney, brain, or other major organs. Furthermore, it can result in symptoms like inflammation and swelling of the joints and other organs. When the immune system functions normally, it makes proteins called antibodies that protect and fight against antigens, like viruses and bacteria. Lupus causes the immune system to be unable to differentiate antigens and healthy tissue. Although the underlying cause of autoimmune diseases is unknown, most doctors believe that lupus results from both genetic and environmental stimuli. History of lupus. Lupus in the classical period, 1230 through 1856. The word lupus was Latin for wolf. It attributed to the 13th century physician Rogerius, who used it to describe erosion facial lesions that were reminiscent of wolf's bite. With that said, in 1846, the butterfly description of the facial rash was coined by von Hebra. The symptoms of lupus. People with lupus may experience a variety of symptoms that include fatigue, skin rashes, fever and pain, and swelling in the joints. Other symptoms can include sun sensitivity, oral ulcers, arthritis, lung, heart, and kidney problems, seizures, among other things. Lupus symptoms can be managed. People of all ages are affected by lupus. However, women of childbearing ages 15 through 44 years are at greater risk of developing SL, and women of all ages are affected far more than men. Minority, racial, and ethnic groups, Black African Americans, Hispanics, Latinos, Asians, and American Indians are affected more than Caucasians. According to the Lupus Foundation of America, estimates that 1.5 million Americans and at least 5 million people worldwide have a form of lupus. Diagnosing lupus. What are 11 signs of lupus? You may have lupus if you have at least 4 of these symptoms. Number 1 is a butterfly-shaped rash, raised red patches on your skin, you're sensitive to light, ulcers in your mouth or nose, arthritis in 2 or more joints plus swelling or tenderness, inflammation in the lining of your heart or lungs, seizures or other nerve problems, too much protein in your urine, low blood cell counts, certain antibodies in your blood, results from blood tests called ANA tests that suggest you may have too many anti-nuclear antibodies. The immune system. How does lupus affect the immune system? The immune system is an elaborate network of cells, tissues, and organs that helps to protect the body from invaders, bacteria, viruses, fungal infections, and parasites. Usually, the immune system develops only to act upon foreign substances, and immune system cells that are to combat the body's cells are weeded out during the development process. However, in lupus and other autoimmune diseases, the immune system begins to recognize and attack itself. In other words, the cells of the immune system start to injure the body's own tissues. The phenomenon is like friendly fire and can cause permanent scarring that ultimately jeopardizes the function of specific organs and systems in the body. There are 4 types of lupus. Systemic lupus erythematosus, SLE. Most commonly, it affects many different parts of the organ systems in the body. It's marked by chronic inflammation, especially of the kidney, joints, and skin. Second one is lupus limited to skin. The term chronic cutaneous lupus. A skin biopsy is usually obtained to diagnose skin lupus, and each possesses its own characteristic lesions and pattern. Third one is drug-induced lupus erythematosus. Certain drugs can actually cause lupus-like symptoms in people who do not have SLE. This form of lupus is temporary and usually subsides within months of the time of the medication is stopped. The fourth one is neonatal lupus erythematosus. A particular form of lupus known as neonatal lupus may affect the babies of women with specific autoimmune antibodies. Only about 40% of women bearing children with neonatal lupus actually have lupus, but lupus of Sjogren's dry eye syndrome may occur later in life. Treatments for lupus. Although there is no cure for this disease, treatment options are available for patients who have lupus. Diet, exercise, and addressing mental health will play a big part in helping manage the disease. Here is information on support groups. No one fights alone with lupus. The Lupus Foundation of America. Here is a public announcement for tobacco-free Florida. There are 3 and easy ways to quit. One is a phone call to quit coach who can help you quit tobacco. The second one is an online help quitting tobacco. It's only a few clicks away with the following link. The third way is looking for face-to-face help. Find classes near you.